Good afternoon. This presentation will focus on the role of physical activity and exercise in cancer prevention and survival. So obviously defining these two terms is very, very important at the outset. So we define physical activity as any body movement produced by your skeletal muscles resulting in energy expenditure above rest. But if you really want an easy definition, if you're sitting, if you're reclining, or if you're lying, you are physically inactive. So if you're doing anything other than those three things, you're probably physically active. And that can include most activities, actually, most physical activities are incidental in nature. For example, many of the work-related activities that we do throughout the day, and also home-based activities such as gardening, playing with kids, washing the car, or doing the laundry. And other activities such as commuting to work, shopping, are also examples of daily physical activity. So they're incidental activity that we get throughout the day. In contrast, exercise is discretionary, voluntary, structured physical activity. So it's discretionary. You take it, you voluntarily undertake this activity to improve or maintain your physical fitness or health. And when we think of exercise, we tend to think of sports people, but it's not just sports people. Many of us in our daily life will go to the swimming pool, we'll go to the gym, tennis, cycling, etc., etc. And where we're doing purposeful, voluntary physical activity, that's what we refer to as exercise. Because I'm going to talk about two studies. One is going to relate to physical activity, and the other will relate to exercise. So in Ireland currently, our physical activity guidelines were updated last year, and they recommend that we reduce sedentary time, and we should replace that with some physical activity, and any activity is better than none. So the current guidelines is that we should all get at least 150 minutes of what we call moderate intensity aerobic physical activity. And that's equivalent to a brisk walk. We should get that per week. Or if you want to, you can get 75 minutes of vigorous physical activity, and that's going for a cycle or a jog, something that's a little bit more strenuous and would really get you out of breath. That's our current recommendation. And we should be getting this 150 minutes a week, or 75 minutes of vigorous activity a week. So the big question is, does meeting these physical activity recommendations give you a quantifiable protection against cancer? That's the big question. And that's what this study set out to answer. It's an excellent study. It was published in 2019. And what it examined the dose, what we call the dose-response relationship between physical activity and cancer risk. Now, what it did, it involved the pooled analysis of 9 large prospective studies undertaken in the US, Europe, and Canada. And it involved over 750,000 participants. And they were followed for approximately 10 years. And there were 50,000 cancers accrued and were analyzed during that time. And importantly, the most important finding of this study was achieving the recommended dose of physical activity was associated with a significantly lower risk for 7 different cancers. These included liver, myeloma, non-Hodgkin's lymphoma, kidney, endometrial, colon cancer in men, and breast cancer. That was a really, really significant finding. Now, one of the most striking findings in the study was that achieving the recommended dose of physical activity does not have a uniform effect. As you can see here, the strength of association between being physically active and your risk reduction, it varied depending on the type of cancer. For example, if you met the recommended amount of physical activity, it reduces your risk of breast cancer from 6 to 10%. In contrast, it reduced your risk of liver cancer from 18 to 27%. And as you can see, it varied. The relationship between the dose, meeting the recommended dose of physical activity and reduction for these 7 cancers, it varied. It wasn't the same for all of the cancers. And this large difference may reflect important differences underlying the biological mechanisms responsible for the effect of exercise on each of those cancers. Now, you know, in the world of fitness, it is common to assume that more is always better. And this research challenges that notion, particularly in relation to cancer. And what they found is two different patterns emerge or were identified here. In fact, for some cancers, the benefit kept increasing. The more activity you did, the greater the benefit that you got. So, for example, the risk for breast, colon, endometrial, esophageal, adenocarcinoma, and head and neck cancers continue to decrease as people engaged in physical activity, even beyond the recommended daily levels. So, for these cancers, pushing further did yield additional benefits. And we'll look at two examples here. Here was breast cancer. And as we can see, this is the recommended, this is the amount of activity we should get each day, between 150 to 300 minutes. Don't worry about what's on the bottom here. That's just another way of expressing it. So this is the recommended. But as you can see for breast cancer, if you go beyond the recommended, you still get a decrease in risk for breast cancer. And we see the exact same thing with colon cancer, an improved risk with the more activity that we undertook. For other cancers, okay, the benefits began to plateau. So, for example, for kidney, gastric cancers, liver cancers, and non-Hodgkin's lymphoma, particularly in women, most of the risk reduction was achieved by just attaining the recommended amount of physical activity per day. And beyond that point, doing more physical activity was associated with little or any additional risk reduction. And again, here's two examples. Here is liver cancer. So here's the recommended dose. You can see you get a huge reduction once you start engaging in physical activity, and it plateaus out just at the maximum daily recommended levels, and you get no further benefit if you go beyond that. We take a look at kidney cancer. We say you have to meet the recommended dose before you start to see a benefit. But then, as you can see, if you get to the maximum recommended dose of around 300 minutes of moderate intensity, you don't get any appreciable benefit by going beyond that amount of activity. So for the second type of cancers, for example, the liver and the kidney cancer, consistency at the recommended level is the most critical factor. Whereas the other cancers, the more you do, the more benefit that you're going to actually accrue. So the key message here is that the relationship between exercise and cancer risk reduction is not a one size fits all. It depends on the cancer. The study also uncovered specific instances where the protective effects of physical activity were not the same for both sexes. And again, this just underscores the complexity of cancer biology. For colon cancer, the reduced risk associated with exercise was evident in men, but was attenuated in women. In contrast, for non-Hodgkin's lymphoma, a reduced risk was observed only in women who exercise, but the same effect was not seen in men. So these findings again highlight that risk factors do not always operate universally. So again, another striking finding was that the strength of the association between the intensity of activity and risk reduction varied depending on the type of cancer. For example, moderate intensity activity showed a significant association with lower risk for breast, and kidney cancer, whereas you had to undertake vigorous intensity activity before you saw an appreciable risk in endometrial cancer. And then, as we can see in colon cancer, it was borderline significant for both moderate and vigorous physical activity. A common assumption is that physical activity helps prevent cancer primarily by helping individuals maintain a healthy body weight or BMI. So what they did in this study, they adjusted for BMI and found that most of the cancer studied, the risk reduction associated with physical activity remained. So basically what this tells us that physical activity itself confers biological benefits against cancer that are independent of weight control. There was one exception, and this was the association between exercise and endometrial cancer. This disappeared after you adjusted for BMI. So this indicates that specifically for endometrial cancer, the protective benefit is indeed likely mediated through weight management. So again, for all the others, however, this should actually be a powerful motivator because it shows that the physiological effects of exercise on hormones, inflammation, metabolism offer a direct line of defense regardless of what your body weight is. So that's a very, very important message. So the take-home message from the study was that there is now robust evidence to recommend 150 to 300 minutes of moderate or 75 to 150 minutes of vigorous intensity physical activity per week to lower the risk of 7 distinct cancers. And for several cancers, additional benefits may be gained by activity levels exceeding the minimal recommendation. However, these are observational data, okay? And so we track someone over time, and these consistently link post-cancer treatment physical activity to lower reoccurrence. So we're now looking at survival, and we know that if you're physically active after you've got over your cancer, that will increase survival. However, just because there's a relationship between something or a correlation does not mean a cause and effect. Okay, so this definitive causal evidence is lacking, and that requires a randomized controlled trial. And the first big trial ever undertaken was published last July, called it'll come to me now in a moment. It'll come to me in a moment. So this trial, what it did was it looked at colon cancer. And the study recruited patients with stage 3 or high stage 2 colon cancer who underwent standard treatment that included surgical resection followed by adjunctive therapy. And up to 40% of patients have disease reoccurrence. And the adverse effect of treatment undermines also their quality of life. So in fact, it was called the Challenge Trial. And this was a phase 3 international randomized controlled trial where 889 patients who underwent complete resection and completed the adjuvant therapy 2 to 6 months earlier were randomized to an exercise program for 3 years. So now this is exercise or health education. Okay. And what we find here is during a median follow-up of 8 years, the primary endpoint, which was disease-free survival, that was risk of reoccurrence or death, was significantly favored in the exercise group. They had a greater disease-free survival. In fact, if you look at the 5-year disease-free survival, it was 80% in the exercise group and 74% in the health education group. So basically, in effect, the exercise reduced the risk, or the hazard ratio indicated that exercise reduced the risk of disease reoccurrence or death by 28%. If you look at overall survival, this was a key secondary endpoint, and it again favored the exercise group, 90% versus 83%. And again, overall survival improved significantly with a 37% reduction in the exercise group. And again, if you look at baseline, there was no difference between physical activity levels or fitness levels between the two groups. But during the 3-year study, the individuals in the physical activity group increased their levels of activity and also improved their aerobic capacity. Okay, so in effect, this study showed that exercise, planned, structured physical activity improves disease-free survival in colon cancer patients. And hopefully we'll see further studies in other cancer types. So the biological rationale for this was improved immune function, reduced systemic inflammation, and improved insulin sensitivity. But what we need to do now is we need to continue with these kind of studies. We clearly understand that exercise is beneficial for reducing cancer and for improving survival. We now have to understand the appropriate dose-response relationships specific to each cancer. Thank you.